What does the term genetic healthcare encompass?
Is taking care of the well-being of individuals.
What do you have to study to be able to provide treatment?
A genetic counselor can communicate the complex reports of the laboratory.
Imagine helping someone discover the secrets of what's written in their genes and guiding them towards healthier choices. Now, that's the power of a career in genetics healthcare. And to unveil this career, I have with me the founder and the director of Genetic Health and Research Center, Dr. Nandev Chopre. With more than 30 years of experience as a leading medical geneticist in India, Dr. Chopre has been spearheading a mission to raise awareness and provide better genetic healthcare to every strata of our society. After obtaining his MBBS and MS in human anatomy degrees from GMC Nagpur, he specialized in medical genetics from Adelaide University in Australia and also from St. John's Medical College in Bangalore. He then went on to obtain a PhD in medical genetics from the Maharashtra University of Health Sciences. Please welcome Dr. Nandev Chopre. Thank you so much, Doctor, for taking out the time to do this podcast with us today.
Thank you. Thank you, Ruchika.
So, Doctor, my first question to you is what does the term genetic healthcare encompass?
Yeah. So, Ruchika, if we just look at the healthcare as a term first, that means taking care of health, right? And that is restoring well-being of individuals in the physical, mental, and social domains. It's not merely the absence of disease. It's not merely treating the patients. It's taking care of the well-being of individuals. And when we talk of genetic healthcare, it is taking care of the well-being of individuals who are suffering with the genetic diseases and even those who are not suffering with genetic diseases, but they have concerns about the genetic issues. So you can talk about like taking care of people who have errors in the structure or function of their genes, DNA or chromosomes. It also encompasses in improving the health of normal people using our knowledge of genetics. And what does it cover actually is diagnosing the diseases or finding out who is at risk of developing certain diseases at the earliest possible, managing wherever there is a disease, and preventing wherever there is a risk of inheriting a disease or developing a disease in the lifetime later. Not only that, it also covers the identification of risk of various common diseases for all of us, including cancers, diabetes, hypertension, and you will see the most of the common diseases also now can be identified at the earliest. Apart from that, it includes the prenatal testing to identify babies who are having the genetic abnormalities, infertility, and even predicting how we can respond to various medicines. So what we're talking about is personalized medicines in the coming years. So ultimately, it's taking care of our life not only at the level of symptoms, but at the most fundamental level, that is our genetic level. So that's what a genetic healthcare is.
Can you shed some light on the whole gamut of services that are offered within genetic healthcare? You did mention few, but if you can give us the whole spectrum.
Right. So the most important aspect of genetic healthcare is providing genetic counseling, where patients are counseled about the nature of the disease they have, the likelihood of happening something in the future, what we call as prognosis, explaining about the available management, providing wherever the management is available, explaining the various options available to deal with the diseases, preventing the birth of the abnormal babies by doing the prenatal testing. And there are so many other aspects. These are the major aspects. Now, apart from this, we are talking about like creating social awareness wherein people get present to the impact of their, you can say, the day-to-day life activities on the expression of their genes, what we call as epigenetics. That is also coming in a big way. So there are a number of domains wherein it can be practiced.
So, what are some of the typical roles and career paths that one can explore within genetics healthcare?
So you can see if we look at the scenario in our country, you will see there are people who are practicing as genetic counselors. So independently, they are having their clinics and they are providing counseling to patients who are coming to their clinics. There are people who are working in hospitals, bigger hospitals, institutions. There are people who are involved in teaching genetics. There are medical geneticists or what we call as clinical geneticists who are practicing who are the medical doctors and practicing in reality on the ground in hospitals, wherein they are diagnosing, treating, preventing everything they are doing. So it is like genetic counseling, medical genetics. There is laboratory genetics coming in a big way, wherein number of organizations are bringing in the labs where testing are being done, chromosomes, genes, and all different kinds. There are a number of tests now available. Apart from that, there is research happening in the genetics. So research is one of the big domain wherein we are finding out the different genes responsible for the diseases. We are now even looking for what are the best modality, the advanced modalities of treatment for genetic diseases. So there are a number of domains, and one more domain now we can talk about is the application of AI and the different tools in the practice of genetics. These are the different domains.
So, what kind of patients or cases actually seek for genetic healthcare?
Right. So when we talk of patients per se, you can see like from marriage, means those who are getting married before marriage, even people need counseling, genetic counseling, especially in cases where there are hereditary diseases inherited in the family. Now, couples who are having certain issues themselves and planning the pregnancy, infertile couples, couples with repeated miscarriages, couples who have had the history of, you can say, the previous baby deaths, neonatal deaths, babies born with the birth defects, developmental delays, mental retardation, number of birth defects are there. You can say people, the children with sexual ambiguity, or anything which is unexpected as far as the related to the age of the individual. So maybe excessive height or short height, excessive obesity or very thin individuals. Then there are a number of diseases like which are identified in the hospitals by the clinicians. There are about 7,000 different diseases which can be identified today. So there is a very wide range of you can say indications for genetic counseling. Apart from this, now people who are having history of genetic disease in their family, they would like to know whether they are at risk of developing the disease or they are at risk of inheriting the disease. Couples during pregnancy, or especially pregnant mothers who are pregnant, advanced age mothers, or during pregnancy, if you find out something which is showing some abnormality or some marker which is suggestive of genetic abnormality, there we go for the prenatal diagnosis, testing the fetus. So these are the different areas of, you can say, the practice, actual practice.
So, how is genetic healthcare distinct from the traditional medical treatments?
Right. So if you just look at the traditional medical treatment, you will see that in the most of the healthcare sector, what doctors do is treat the diseases once they occur. So the role of a regular conventional traditional doctor is not to prevent, though the most important part of healthcare is prevention of the disorders, but the major role doctors are playing is prevent the treating the diseases once the diseases occur. But in case of genetic disorders, you will see that genetic healthcare is proactive kind of thing. Wherever people sense a risk of developing some disease or inheriting some disease, they would like some information about it. What can be done? What are the diseases? Whether they are carrying some gene mutations. Are they at risk of inheriting it? And what is the risk? How can we prevent it? Do we have any options available to deal with that risk, to prevent the birth of abnormal babies? So all that. So genetic healthcare is mainly diagnosis related, prevention related, counseling related. Treatment part of the genetic disease is very limited so far because there are so many diseases and most of the diseases don't have any cure available. So we are talking about different therapies. We're talking about the available management for some of the signs and symptoms. But at root level, like at the gene level, we don't have the therapies which will cure the disorders. Though some of the gene therapies are coming in practice slowly, but that's not the routine thing happening. So that's how it
So,
differs. Like
so how does a patient decide that this is the right time for a genetic healthcare's intervention?
you will see that in most of the instances, patients don't decide, they don't understand that this is genetic and they need genetic healthcare. Patients will go to
Exactly.
the routine, their own family physicians, the specialty doctors for seeking
Precisely.
advice, right? And then these doctors, like gynecologists, obstetricians, pediatricians, general practitioners, neurologists, cardiologists, then they will refer. Once they sense that there is a possibility of the genetic disease, they will refer the case to the genetic counselor or a medical geneticist. Sometimes now with the increasing awareness, sometimes people also do come to understand when there is a specific history of genetic disease in the family, or there is a person who is already identified, or they are suspicious of the inherited condition in their own life or in someone's related life. So generally, most of the more than 90% of the patients coming to the OPD in genetic counseling setup and medical genetics, they are referred patients.
Yeah, okay, understood. Now, medicine, as we can see, is slowly transitioning from one size fit all to a more tailor made approach. And genetic counselors are at the helm of it, which are leading this revolution. So, on that note, what kind of an academic background you need to possess if you want to make a career or you want to pursue a career in this field?
Right. So if we just look at the scope of practice of genetic counseling in our country, in India, in the Western world, there are so many genetic counselors and they are already well settled in this particular practice. But in our country, it is slowly evolving. There is a tremendous need. There is a tremendous, you can say, burden of the genetic disorders already existing, but we have very few people available. And the transition that you are referring to, so we are transitioning from the conventional medical practice to the specialized, personalized medicine, wherein we are talking of providing specific drugs in specific amount for a specific duration to a person based on his genome, based on his genetic variations. So that we can prevent most of the, you can say, the side effects of the treatments, and we can get the optimum, you can say, the outcomes out of the any treatment. So for this kind of counseling, my personal opinion is genetic counselors who are coming from the non-medical background, means those who are not the doctors, they can't do this kind of practice. What they can do is they can provide genetic counseling in certain specific settings. Like they can work under the supervision of the specialists like obstetrician or infertility expert or neurologist or oncologist that way. But independently, it is very difficult because it involves a lot of understanding of medicine, which is not available with most of the genetic counselors who are coming from non-medical background. People who are entering from medicine into genetic counseling, they definitely have the understanding of medicine. They have understanding of diseases, common as well as rare diseases, and they can be updated very fast. So they can bring in this kind of, they can be a part of this transition. Conventional genetic counseling, which is pursued by the non-medical graduates, so where generally we need the biology background for that, people who are getting trained into maybe MSc biology, MSc biotechnology, and any kind of biological background, they can be trained in genetic counseling, but they cannot provide treatment. They must understand this.
So, what do you have to study to be able to provide treatment?
So providing a treatment first, providing a treatment is a job of a doctor. It is not a job of a counselor. Counselor, by definition, is someone who is explaining the complex information in a simple way so that patients understand. A genetic counselor can communicate the complex reports of the laboratory to the
Okay.
patient so that they understand. The counselor can explain about the available the involved risks. He can talk about the available options, but he can't provide any kind of treatment. And all this has to happen in, you can say, consultation with the experts of those specialties, different specialties. So if a child is coming with the cardiac disease, a genetic counselor is not supposed to understand heart and heart disease, right? But heart disease, as it is investigated by maybe the other physician or the already existing reports are there. So,
Mm,
by doing the genetic analysis, interpreting the test reports, and telling the patients or the families, and even the specialist involved in the
mm,
treatment,
mm.
what is the nature of that gene? And what is the
Understood.
risk of recurrence? What is the maximum possible, you can say, prognosis outcome, later
Mm,
outcome?
mm.
But treatment part is not the part of the genetic counselor, regular genetic counselor. So
Okay.
genetic counselors can be people who are coming from the non-medical background, but they are having the postgraduate degrees in either genetic counseling or medical genetics, or people who are coming from biotechnology, even the physiology, anatomy, microbiology, pathology, but they pursue a specialized training in genetic counseling for minimum of 2 years thereafter. So that is what the requirement for being a genetic counselor is. But
So,
for
what are
treatment
some of
purpose,
the,
yeah,
yeah, sorry, please go ahead.
ma'am, that's all. Okay, go ahead, please.
What are some of the specific undergrad degrees or postgrad degrees or majors that one can take up so that a student is better prepared to take up a career in this field?
Right. So when we're talking of undergrad, any biology undergrad degree is eligible. Once you go for the post graduation in biology, again, like as I mentioned about biotechnology, maybe even bioinformatics, genetic counseling. There are some of the courses, MSc genetic counseling, MSc medical genetics. So MSc genetic counseling, MSc medical genetics are the specialized postgraduate courses wherein people are well trained for delivering the genetic counseling.
But would you say that it should be a prerequisite, or a student will be better prepared if the student has biology in grade 11 and 12th as well?
Yeah, without having biology in grade 11 and 12, the student cannot enter into biology stream, right? Even for the
Yes,
graduation. So that's a
yes.
prerequisite, absolutely.
Yeah, because you did mention that a non-medicine student can also later venture into genetic healthcare field.
Absolutely.
So how will that transition happen if you have not taken biology in 11th and 12th?
Yeah,
Because
so biology is mandatory. That's what I said.
okay.
In 11th and 12th, biology,
Hmm.
without having biology as a subject in 11th and 12th, they cannot enter into the graduation and post-graduation with biology, right?
Hmm.
So that's a prerequisite, biology, chemistry.
So I'm just trying to understand the career path so that I simplify it for our student community. So you take up the biology is one of the necessary subjects to take up in 11th and 12th. And then once you are done with 12th, what is the program or the course that one should opt for or look out for in the undergrad? You did talk about postgrad, but are there any specific courses one can take up in undergrad so that they have a more focused approach towards genetic healthcare if they have that clarity to pursue it right from 11th and 12th?
Right. So, so in graduation, so you can see, as I said, ki any biology graduate doing a BSc or BTech, biology graduate, okay?
Okay.
So as I said, bioengineering, biotechnology, bioinformatics,
Hmm.
in general biology,
Hmm. Hmm.
it can
Hmm.
even be agriculture, it can even be zoology, microbiology,
Okay.
biochemistry. All these bio sided, you can say, undergraduate degrees, they
Mm-hmm.
can prepare you for the post graduation. Now, post graduation, either you do
Mm-hmm.
directly the medical genetics MSc or
Okay.
MSc genetic counseling,
Okay.
or you do the post graduation in biotechnology as a general field, biotechnology, bioinformatics, that way.
Okay.
And then thereafter, you can pursue the special course in genetic counseling.
Okay. So, are there any certifications available to pursue uh, any?
Yes, yes, there are some of the institutions in our country which are providing the MSc courses in genetic counseling and medical genetics.
Mm-hmm.
And our institute also, we have
Yeah.
an Institute of Medical Genetics,
Okay.
and we are offering 1 year program for the postgraduates and mainly
Okay.
to the doctors, MBBS and postgraduates.
Okay.
There's an online program, only online program, wherein we are providing all the necessary, you can say, detailed training for being
Mm-hmm.
able to provide genetic counseling and practicing medical genetics also.
What is a typical structure like uh, of a genetic healthcare or genetic counseling program that you talked about? Like,
So, genetic counseling and genetic healthcare, these are two distinct domains. If we just look at genetic counseling is simply communicating
hmm,
with the patient
hmm,
in such a way that the patient understand the complex science of genetics. Whereas genetic healthcare is a big domain in which genetic counseling is a very, it is very integral part. It is important part, but it is a little part of it. Healthcare will involve managing, treating, preventing,
okay,
right?
okay. So, what is a structure of a genetic degree program? Is there a structure to it that these are the kind of subjects you are going to study in the first semester, second semester, and so on and so forth?
Yeah. So if you just look at the required, you can say, knowledge and the skills for pursuing the career in genetics, especially genetic counseling, the most important aspect of this is basics of genetics. You understanding genetics, science, human genetics. Second is you understanding communication, a very proper communication wherein you are translating this complicated language in a very simple language and ensuring that patients understand.
Correct.
So communication is one of the important part wherein it involves the compassion, it involves active listening, it involves ensuring that the information is delivered, it involves the ethical, there are a number of issues. The second part and third part is actually on the ground dealing with the patient. So students of the programs, genetic counseling program, usually undergo classes. So there are classes wherein they are teaching about genetics, human genetics, and diseases. So some of the diseases, not all the diseases, some of the diseases, wherein the students can understand the principles of genetic counseling. Second part is they getting trained into the communication process. Communication is a big aspect of healthcare delivery. So communication is one of the most important part of the curriculum of genetic counseling. And third part is actually being posted there in the hospitals and OPDs to actually observe the patients, observe being counseled, getting trained in that, providing the genetic counseling under supervision. So that can be divided into number of different modules and different institutions have different, you can say they are divided into different semesters.
How important is the research or the lab experience when you are applying for a program in genetic healthcare? Like, how should a student choose that this genetic healthcare program in this particular institute is a right fit for him? Does the research and the lab experience plays a pivotal role if it is integrated with the curriculum?
Yes. So you will see that research is something which will give them idea about uh, how do we know what we know, and how do we find out something that we don't know, right? So people who are venturing in this particular field which is new, and as they are entering into this field for a very long time, they should have a proper understanding of what research is like. It's not necessarily the most basic research at the laboratory level, but even the social the research in the community, all that also matters. So that is one part of the program, and that is important part. Second is the lab exposure. So genetic counselors need not be the laboratory geneticists. There are people who are well trained in the laboratory to do the investigations, to interpret the reports, but genetic counselors should have understanding of what is happening in the lab. So they should have exposure for sure. What investigations are being done in the laboratories, which are the different laboratories doing it, how much time it takes, what are the different processes involved, but they need not get trained in the laboratory techniques and procedures.
Okay.
Exposure is definitely necessary.
All right. What are some of the essential skill sets or the mindsets that someone should have, when they enter the genetic healthcare field, or to have a sustainable and a fulfilling career in the genetic healthcare domain?
My personal opinion, I'll share with you.
Mm.
So the most important mindset a genetic counselor should have is the willingness to contribute. Why I'm saying this is because you will see that the patients and families who are having genetic diseases, they are in tremendous pressure. They don't get the appropriate answers to their questions. There is a lot of uncertainty. There is a lot of, you can say, they go through a number of spaces of emotions, emotional spaces. So you, if you have the ability, but before the ability, you have to have the willingness. You should be willing to contribute. It's not a kind of business. You will earn definitely your living. You can earn good also. But if you have the willingness to contribute, and then developing the ability to contribute, which requires the main element as a compassion, you should be able to listen to people to such an extent that there is nothing left at their end. They are emptied out completely. People feel they are heard. It's not merely about tests. People won't understand tests. They won't understand the terms of the diseases. What they will understand is what you are speaking. And they will understand only when you enter their world. You really get their concerns. So the most important mindset, in my opinion, is willingness to contribute.
And also maybe the empathy or
Yeah,
to step
compassion,
into
that's a
their
part of it.
shoes. Yeah.
Absolutely.
What are the most in-demand jobs in genetic healthcare right now?
So if you see in our country, genetics is evolving, slowly evolving. As I said, like there is a huge burden. If we really look at the numbers of the patients with genetic diseases and people who are worried because of the concerns related to genetic diseases, there's a huge demand. And slowly now this is being realized at different levels. So um, I'll say that in hospitals, most of the bigger hospitals, institutions, infertility clinics, oncology clinics, specialty hospitals like neurology, cardiology, oncology, endocrinology, all these people will employ genetic counselors. Apart from that, genetic counselors can practice independently as a genetic counselor. So there's a huge demand. I hope I got the question right. Is the question different?
Absolutely, absolutely. Yeah,
Yeah.
this is the question. So, what would you suggest a high school student who is interested in this field? How should they start? How should they prep up?
So, if we talk of the high school students won't have much of the understanding of, you can say, the world of genetic counseling or medical genetics, but they can really get some sense by just visiting some of the places where there are patients with genetic diseases, some of the special schools, some of the hospitals with genetic diseases, or some of the, you can say, the parents groups, special groups, that they can do that. Okay, parents can take them there. Second thing, they can start reading about what is happening in the world of genetics. So it's not limited only to the genetic counseling or medical genetics. Genetics is encroaching everywhere. Genetics is encroaching everywhere. So they must keep updated about. They must keep reading the news, listening to some of the you can say the video news about the contribution of genetics and the research happening in the field. Slowly, genetics is going to be a part of not only the biology, but it's going to be a part of engineering. Right now, there is genetic engineering already in existing. There are a number of products coming in. There is a lot of genetics involved in used in research. There is a lot of genetics used in AI. There is a lot of genetics used in the computer and all those advanced technologies, biotechnology. So students of 11th and 12th, they must keep update. They must keep reading. So they will do their learning of 11th and 12th first. But if they have the inclination, like they have chosen, "Okay, I want to pursue this career," they can definitely keep themselves updated and visit some of the places where the actual work is happening. So as to get the sense of what kind of work is involved if they enter in the field.
Yeah, that's a very good advice. It's a wonderful way to explore this career before you make any decision
Yeah.
to get into it. So, what are some of the common myths and misconceptions about careers in genetic counseling or genetic healthcare?
Um, As such, we don't have much of the myths because we don't have much of the awareness about genetic counseling as a
Hmm.
field so far. But see, people when they think of choosing a particular career, what I have perceived is about genetics, genetic counseling, that this is not a field which can give you a lot of money. So this is one of the myth, and that was consistent with what was happening so far because there was no awareness. But now the awareness is tremendously increasing, and there is a tremendous scope happening in or being created in most of the hospitals and institutions. That is one part of it. Second is people think like genetic counselors only talk about the bad news or diseases, right? But it's not that.
Okay.
Genetic counseling counselors are the people who can actually create a space of ease. They can empower people in whatever situation they are. So, what I practice, I'm practicing as a medical geneticist for the last 25 years. I'm a medical doctor and as a genetic counselor also. So, what I've seen is even in situations where there is no cure available, there are diseases, number of diseases where cure is not available, and the diseases are so lethal. But if you provide genetic counseling correctly with compassion, you will see magic happening in the genetic counseling session. So genetic counselors can create a magic. Magic of what? So they can bring in the happiness in whatever situation the patient is. They can at least create the acceptance. They can create a level of satisfaction. They can resolve lot many conflicts happening in the families. So you will see that in most of the families, just because of the disease occurrence in a child, there is a lot of conflict. So there is a blame game. There are fights happening and you undergo tremendous stress, pressure. And genetic counseling is some counselor is someone who can actually resolve all those issues. So what I look at it is like a genetic counselor is a possibility of empowerment in all the possible situations. Properly delivered, definitely it has got the power of empowering, enlightening people rather.
Can you share one example of a real life example of how did your genetic counseling really impacted the life of one of your patient?
So there are thousands and thousands of them. That is what I do on a regular basis. So just as an example, I'll tell you. I started my career in genetics when I completed my MBBS. And that time we had a OPD, genetics OPD in our department in Government Medical College, Nagpur. And I used to sit in that OPD. And when I saw for the first time a patient with Down syndrome, parents brought a child, they were referred by the pediatrician. And when I looked at the child was so happy, bubbly, but parents were too tense, depressed. For a simple reason, the pediatrician and the other doctors, they said nothing can be done about it. The baby is going to be mentally retarded. There is no treatment available. The baby will not survive longer. Now, this is a very long, very, you can say the early story. This was in 94, 95. Thereafter, there is a lot of advancement that happened. Now, this is one of the example I'm telling you where in cases of Down syndrome, every day I'm doing that. This is not a particular one case. In cases of Down syndrome children where there is mental subnormality, there is muscle weakness, there are a number of other health issues. So once the child is diagnosed with Down syndrome, you label it as Down syndrome, and doctor talks about what is going to happen. If it is not delivered in a proper way, patient take it as a huge burden. Burden of what? Not of the present moment, burden of the future. What will happen next? This child will not learn, this child will not do graduation, will not do post graduation, will not earn money, will not be able to marry, will not. All so many questions are created because we say that the child has Down syndrome. And patients also read from now, there is a knowledge is available. So from the Google, they can read about what Down syndrome is like. Now, in this scenario, one of the scenario which I'm doing daily, okay, I'm the president of Down syndrome, national president of Down syndrome care association, where we are providing counseling to around 600 families on a regular basis. So that is one of
Wow.
the races.
Hmm.
Now, in this scenario, when patients come to you with a child who is mentally retarded or which you have labeled as someone who cannot be treated, if you listen to them, you first listen to them keenly. What are their concerns? What are they afraid of? What do they know about the condition? You listen everything. And then you provide the factual information. This is what we know. But this is what we know. This is not the reality. What can happen next is what you make happen. What I mean to say is you creating a space of acceptance of the child as it is. The child doesn't know that the child has problem. Parents were not also aware that the child has a problem. We, the doctors community, made them present that the child has something called as Down syndrome. And Down syndrome is this. There is nothing right now. And the problem is created because they see the future, which is dark. Now, here the role of a genetic counselor, which I'm doing, is creating a space where they come to the level of acceptance. Let it be as it is. This is my child. There is no problem. There is no problem with the child as such. It's not the problem of the child. It's not our problem also. We are not responsible for this. The child is not responsible for this. And then there are a lot many available support systems. There are a lot many supports wherein the child can be groomed and developed well. And with this kind of acceptance, then parents can create the space for appropriate development of the child at home, and parents can take the child to all the places necessary for maintaining its health, managing its health, and its overall development. And there are hundreds of examples now in our country wherein you will see children with Down syndrome, they have accomplished a lot. I have one of the example here in Nasik itself, a boy who is around 18 years now, and he is an international champion in swimming. He has got a
Wow.
President's Award twice. He has got international awards, international records, six records he has made in swimming. We have a mother
That
with
is
Down
that is
syndrome.
so empowering and liberating, no, for the parents of that child and for the child himself or herself. I mean,
Yeah,
yeah.
we have one person with Down syndrome who is doing job as a librarian. That person is also from Maharashtra. There are a number of such examples now in our country, but I'm sharing some of them where I have been, you can say, facilitating that process. There are a number of children with disabilities who are excelling in different fields. And that is possible through the process of counseling. Though there is no cure for the disease, there is definitely possibility living life worthy, living life empowered, living life, you can say, with satisfaction, with fulfillment at
Yeah.
both levels, at the level of the affected and at the level of the family also. Parents are also, some of the parents are so empowered, so powerful that even they are powerful than the other parents of the normal children because they
Correct.
are going through a process of what we call a self-inquiry.
That's so true. So, what inspired you to pursue a career in genetics, healthcare? You have even done a PhD
Yeah.
in this field. So, what is your inspiration story?
Yeah, as I shared with you, that was the inspiration. Like when I did my MBBS and I
Hmm.
was pursuing my MS, that time I saw this child with Down syndrome, and the number of such patients were coming. But one specific family really inspired me, where I just saw that the parents were so depressed and suppressed. And simple listening to their concerns, listening to their worries, simple listening, okay? That was enough to bring them out of that sorrow and sadness. And then I started looking at it, ki we as the so-called normals and the so-called educated people are creating a suffering which is not existing. What I mean to say is, a child with Down syndrome never knows that the child has some problem. Unless and until you tell that child when the child grows, parents don't know that the child has some problem. When the child is born, we say that the child has Down syndrome. So I'm talking only about Down syndrome. There are so many, 7,000, more than 7,000 different diseases are there. For some of the diseases, there are treatments available. So what inspired me that time was ki there is a huge scope and need for listening to people, for communicating with them properly, for empowering them, and then for providing the treatment, whatever is available. And if possible, creating the treatment. So that inspired me. Actually, what inspired me is Down syndrome, the child with Down syndrome and the family of these children. Now, it was long back, and then thereafter, there is a lot of advancement that has happened, and so much of now management is available, treatment is available, prevention is available.
That's so great. I mean, to provide hope
Yeah,
in the times of despair, and to kind of pull them out from the the darkest tunnels, and show them the light. It is such a noble profession.
yeah,
So, do you see a growing awareness and demand for genetic counselors now in India?
yes. See, as I said, ki genetics is going to be an integral part of medical practice now. It's not in isolation, it's a part of each and every specialty now. So you'll see pediatricians are dealing with children with genetic disorders, obstetricians are dealing with that, genetic issues. Infertility clinics, IVF centers, they are very closely working with genetics, oncology, cancer genetics, endocrinology, cardiology. You name a specialty, and there you will see there is a huge scope for a genetic counselor and a medical geneticist. When I say genetic counselor, someone who can actually understand the complex information and translate that in a patient's language and explain it. A medical geneticist or a clinical geneticist is someone who can actually diagnose the condition, which is not possible by the conventional medical, you can say, diagnosis. Provide the appropriate available options, provide the treatments that are available, and do the preventive modalities, provide the preventive modalities for preventing the recurrence as well as occurrence in people. Now that we can even predict diseases that we are going to have in the lifetime later, right? We can even see what are the different variations, genetic variations you have, and which drugs are most appropriate for you. So we are talking of personalized medicine. Now, Nutrigenomics is coming in a bigger way, wherein we are talking of specific diet based on your genetic variation. Though
No.
these fields are in a, you can say, in a very primitive stage right now,
Hmm, 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 hmm.
it is expanding like anything. With increasing laboratories, increasing availability of the genetic tests, there's a huge scope for the genetic counselors as well as the medical geneticists.
This generation is so concerned about how lucrative the career that they take up or they choose can be. They are always talking about the remuneration and compensations that they can earn in their chosen career. How would you define that in the field of genetic healthcare? How you know how lucrative are those packages?
So actually, when we talk of the Indian scenario, as I said, there is an increasing scope, but it is not a well established. You can say ki where people have set norms for salaries and all that. But definitely, people can expect to get salaries from 40,000 to maybe even 80,000, even up to 1 lakhs in bigger hospitals, depending on the experience. But in the Western countries, it is huge. You can say there is a huge demand and a lot of you can lot of earn a lot of money out of it. It ranges from 70,000 to 120, $130,000 a year.
So, do you see a lot more career opportunities abroad than in India as of now? And is this gap narrowing?
In India, we have a lot of opportunities than the Western world. Why? Because in Western world, there are already lot many genetic counselors. Still,
Okay.
because there is a lot of awareness and they are well settled in all the aspects. In our country, it is evolving. So it depends on how people take it. The one who is really committed to make career in this must see this as something which is huge. So there is no limit. It is not established yet.
And before I wrap up, my last question is what would you suggest? What kind of measures one needs to take in order to, have more professionals in the genetic healthcare space in future in India?
So you're asking me regarding the government policies or the educational policies?
More with respect to education.
Yeah. So actually, we need to have more and more institutions coming up for training and teaching in this field, genetic counseling and medical genetics. There are very few institutions currently existing, like Sanjay Gandhi Institute of Medical Sciences, Postgraduate Institute of Medical Sciences from Lucknow, AIMS Delhi. Then we have Manipal University. There are very few. You can enlist not more than 8 to 10 institutions which are providing courses in this. We are one of the Institute of Medical Genetics, who are providing the online programs, and a lot many doctors are getting registered for that. Definitely, we need to have a very rigorous national policy for dealing with the genetic disorders for a simple reason. It's not only about the diseased individuals. If you just look at the percentage, around 3 to 4% of babies born every day, they are having one or the other issues related to genes. And that makes a huge burden. And it's not about those babies only. It's about the families who are associated. So if you just look at 3, 4 members in a family with the child born with genetic disease, all of them are under tremendous pressure. It's a huge burden. This is related to the conventional practice of medical genetics and genetic counseling. But slowly now, as it is evolving and expanding, and we are realizing the, you can say, role of genetics into every specialty, and the common diseases, including diabetes, hypertension, cancers, that way, there's a huge need.
So definitely, we need to have more institutes offering more courses in this domain.
Yeah.
Great. Thank you so much, Doctor, for your time and expertise. We greatly appreciate it. You have, kind of given some great insights in this field. And I'm sure, our viewers will, kind of get to know a lot more about genetic healthcare now than they previously had, before listening to this podcast.
Yes, Ruchika. So I would like to thank you for inviting me for this. This was really um, very good conversation. You had you are well prepared for this particular, you can say, domain. Asking the questions, the way you asked the question, it shows how deeply you got involved into it. And I really want to thank you for inviting me. And at the same time, I want to congratulate you for starting this specific mission of no herd mentality. So
Thank you
people
so
get
much.
aware, students get present to what are the different opportunities. Thank you so much.
No, it means a lot. Coming from you, it means a lot, and we hope to, keep our efforts and our endeavors, on and providing, awareness and enlightenment in diverse careers and professions. Thank you so much once again.
Thank
Uh,
you, Ruchika.
you were listening to No Herd Mentality Career Conversations. Uh,
I have
please,
seen some.
please subscribe to our channel for more such in-depth conversations on diverse careers and professions. I'm Ruchika signing off on behalf of No Herd Mentality.